Hello, everyone, and welcome back to Proof or Potion, the podcast where we dive into the world of natural remedies, alternative therapies, and all things wellness to figure out if they're legit science backed by proof or just another fancy potion that's all hype and no help. I am your host, Morgan.
And I'm Dr. Keely. Together, we sift through the studies, laugh at the myths, and hopefully save you from wasting your precious time and money on things like snake oil.
Yes, and if you've been with us before, you know that we keep it real. We keep it lighthearted as we learn alongside you about new and proven ways to fight common ills. So shout out to all of our subscribers.
Thank you.
Of course, drop a like or comment if you've enjoyed this episode and want to keep learning alongside us. Today, we are shining a light, literally, on neck pain and a potential new therapy that sounds straight out of sci-fi. It's called low-level laser therapy. And we want to know, is it a beaming success or is it nonsense?
But before we zap into that, who wrote this? Let's set the stage with why we decided to take a look at the topic of neck pain on today's episode.
Yeah, so these numbers were pretty surprising to me, right? So while I was doing my research, I found out that in the US, neck pain affects 30 to 50% of adults every year. Chronic cases are between 10 and 20% of the population. Some sources say that over our lifetime, 80% of us will experience neck pain. And post-pandemic, chronic pain overall jumped up to around 24% of Americans. And neck pain is a big contributor to that. And some of that's like working at home, that's stress. Also, we know women are more likely to experience neck pain with a good portion of the cases. Although I'm going to argue that that's really just because women actually go to the doctor to report that versus
Could be
men who often don't.
Yeah.
But that's literally just a side.
because we're hysterical.
Oh, right. Yes, of course.
Yeah, the cost of a medical issue isn't really an angle we have ever discussed before on Proof or Potion, but a common health concern such as neck pain actually has huge costs. Some sources say that neck pain can lead to billions in medical bills and lost work. And with populations aging, it's set to spike even more. And causes of neck pain are super diverse. For starters, poor posture is a biggie. We call it the weak body syndrome or whatever, the slouching over desks, phones, even sleeping in weird positions. You know, when I'm scrolling TikTok with my head forward, it definitely hits later. And then, of course, there's the muscle strain, which, of course, has loads of root causes, you know, lifting something heavy, an intense workout, even whiplash from a car accident. All of this can put serious strain on the neck muscles.
Yeah. And then you've got joint issues, right? So we're thinking like arthritis or cervical spondylosis, where the spine's discs and joints wear down, especially as we age. We can think of like herniated discs, pinched nerves. So there's all sorts of things that can inflame the necks. And of course, let's not forget injuries, sports, falls, awkward yoga poses. I definitely have done that.
Yes, same.
The reasons literally go on and on. Like we even find that obesity can strain neck muscles, smoking reduces blood flow, reduces healing, like a bad pillow. Like, have I named them all yet?
I don't know. My neck is hurting just talking about these.
Yeah. So lots of things, right?
Studies covering non-specific neck pain, right?
Yes, for sure. Non-specific. So any of these reasons, really.
That's why it's also tricky to treat. So many causes, and with aging populations, it's only getting worse. Like we said, what do people usually do about it? Pop a pill, anti-inflammatories, stretch it out, you know, maybe some acupuncture, but, you know, good, bad, meh.
I mean, standard go-tos include over-the-counter pain medications, so think ibuprofen, right? That can help for mild to moderate pain, maybe in the short term. Not a great option for the long term. Muscle relaxants are also sometimes prescribed, but evidence is really mixed.
Yeah, especially when the source of pain we're not sure. Like, you know, there's physical therapy, stretching, strengthening. Some of that can really help, and exercise can definitely be beneficial for neck pain, especially specific targeted strengthening or endurance training. But that takes a lot of time and commitment if it's going to work, and not everyone can stick with that. And that doesn't help long term, you know. Yeah. There's a lot of stuff out there, and it's tough to find the right thing. So let's be real. A lot of these may or may not work.
Which brings us to the star today, the low-level laser therapy. So Keely, what is even low-level laser therapy?
Yeah, I know it can be a little intimidating, light therapy. So, LLT, also called cold laser photobiomodulation, uses low intensity light or red or near infrared wavelengths to stimulate cells without heating or damaging tissue. Unlike surgical lasers that cut or burn, this is non thermal, no heat. It penetrates the skin to boost repair, reduce inflammation, and ease pain by things like increasing blood flow, oxygenating cells, and clearing out toxins in some cases.
Yeah. Currently, it's used in medicine for things like soft tissue injuries, arthritis, nerve pain, oral mucositis from chemotherapy, conditions, and yes, musculoskeletal pain, such as neck pain. It's non invasive, it's painless, there's low side effects.
But is the evidence clear? That's where today's study comes in. We're looking at a 2009 paper from the Lancet titled Efficacy of Low Level Laser Therapy in the Management of Neck Pain, a systematic review and meta analysis of randomized, placebo, or active treatment controlled trials. The authors reviewed 16 randomized controlled trials with 820 patients to see if LLLT actually works for acute or chronic neck pain.
So, you all know we love a meta analysis, right? It really is taking into account more than one clinical trial, which is, in a way, strengthening the argument that they make, right? So, we love these, right?
Mhm.
Researchers included studies on non-specific neck pain, so think strains, whiplash, myofascial stuff, but excluded things like rheumatoid arthritis or radiculopathy, such as herniated disc, degenerative spinal joint disease, and other joint diseases. Lasers were applied to tender points or grids on the neck and compared to either placebo or active controls like exercise. Outcomes were measured via the VAS scale. So, the VAS scale, the visual analog scale, is a tool doctors and researchers use to measure pain intensity in a simple, subjective way. It's basically a straight line, it's 100 millimeters long, and there's no pain marked at one end and worst pain imaginable marked at the other end. And then people have to pick where their pain falls on that scale.
Yeah, so 16 trials, total of 820 patients. The study consisted mostly of women, 79%, with an average age of 43. Across participants, they were experiencing chronic pain for about 7.5 years and had baseline pain scores on the VAS of around 57 millimeters. When it came to the laser treatments, trials used various wavelengths from 632 to 904 nanometers and doses from zero point zero 0.06 to 54 joules per point over 1 to 15 sessions. Studies were also categorized into short-term follow-up under a month, medium-term follow-up 1 to 6 months, and long-term follow-up of greater than 6 months. That's a lot of variation between the studies, and we can dive into that later, but we press on.
Yes. So we've come to what the key findings are of this meta analysis. So for acute neck pain, so that's short term, 2 trials showed relative risk improvements of 1.69, meaning participants were 69% more likely to get better with the laser than placebo. For chronic neck pain, 5 trials showed a whopping relative risk of 4, meaning that patients were 4 times or 400% more likely to improve over placebo.
On pain intensity, 11 trials showed a basically 20 millimeter reduction on the VAS scale right after treatment. That's clinically meaningful. Anything over 12 to 15 millimeters counts as clinically significant. And it lasted. Follow up from 1 to 22 weeks showed a 22 millimeter reduction persisting into the medium term.
But were there any side effects to the treatment? And really, they only found mild stuff like they were tired or they had a headache, but it turns out that was exactly the same as in the placebo group. So, not really a lot going on there. The cool thing about this is they use this study to find a therapeutic window for the wavelength that had the best results, as well as the joules, which is the intensity. Kind of a cool result of this meta analysis.
Yeah, so now we can take that information and apply it, to settings because there's so many different variables. I want to point out too that this study was compiled in 2009, so there have been a couple updates since then. 2013 update review found moderate evidence for chronic neck pain relief up to intermediate term, conflicting for myofascial pain, but suggesting superpulsed lasers help. A 2023 trial showed significant short-term reduction in non-specific chronic pain with LLT versus sham. High intensity variants in 2016 also effective for range of motion and pain. This makes low level laser therapy even more promising since it appears that more recent research only strengthens the findings of the 2009 review.
So it's important for us to mention here that one of the primary limitations of the study is that each of the 16 included trials had a pretty wide range of both laser intensity, duration of treatments, and follow-up time. We kind of mentioned that earlier. So this really makes it hard to like pin down like did it actually work, right?
Yeah. And before we get to like the final verdict, I just want to kind of, regroup
Yeah.
and, that's a lot of data really fast. Is there anything that you kind of want to, discuss
So
about the study?
I do want to discuss the placebo, right? So we did talk that all of these studies were a laser versus a placebo. So the placebo that they actually did, and I thought this was interesting, was it was actually a laser device. It had the little laser control panel. It had the beepings and the whirrings that it made all the sounds that the laser did, but they had the laser function turned off.
Mhm.
So, and I think they said it had light as well. So did it say light?
Yeah. It had light,
Yeah.
it had beeping, just not the actual laser.
Right? So it's a pretty good sham, I think. So people really thought like, oh yeah, I'm getting that as well. So kind of a cool thing with such significant difference over the placebos, right?
Yeah. I feel like with lasers, that is the perfect sham. Yeah. And can we just clarify real quick? So low level laser therapy, we kind of breeze through this, but cold laser, low level laser therapy, photobiomodulation, red light therapy. These are
Yeah.
all synonymous, or what's the difference?
So what we have found is that low level laser therapy is the umbrella.
Mm-hmm.
And then you have like red light therapy is a certain wavelength set.
Which is usually in the 600,
In
630.
Yeah,
or
like
so.
what is
630 to
630
700. I think it's like 637 or something like that.
Okay.
Usually they're in the 600s.
Yep.
Yeah.
And then what was the next step?
It's near infrared.
Near infrared
Mhm.
therapy.
So you're getting
that's
close to not seeing the red light, right?
correct.
If it's infrared is where it's not visible anymore. Is that correct?
Right.
Okay.
And that is in like the 8 to 1100 range. So those are kind of the two different wavelength ranges that make up low level laser therapy. Cold laser is just another term for low level laser therapy. And it's just really saying that we're in the wavelength that does not produce heat.
Yeah. So low numbers in that, 600 to 1,000, 1,100 range or so. Yeah. And then you move through the spectrum because those are nanometers or wavelengths of light. And so you might see all these terms kind of all over the place. And device intensity is a big deal. A lot of these devices, they have, commercial grade, and then there's medical grade, which a lot of it is still kind of the wild, wild west too. But even I have some devices, so I was researching mine and trying to figure out, exactly how many joules are being produced.
It's a huge range, right? And that's part of why I wanted to do this study because I see a lot about red light and people having their red light panels. And now there are different uses for red light. So we're looking specifically at red light for pain, right? Like specifically neck pain. I think probably this translates to probably some back pain or, like along the spine, right?
Yeah.
But looking at it for pain, it really shows me like there is kind of this specific window of what your device should be, how long you're using it, how far away from the skin it should be, right?
And did we say what that was? Did we mention what they found for that opportune?
We
I don't know if we did.
We did not.
Okay.
Oh, but I have it.
Considering trying.
If you're considering it,
ask the doctor. Don't do it because we said so. But
we're not telling you to do it.
The study authors found, based on their meta-analysis,
there's two windows of therapeutic treatment. So therapeutic range is kind of, we've talked about this before with our supplements. There is a therapeutic dose, like this is the dose where you get the most benefit, right?
And everybody's on spectrum too. This,
for sure.
But what they found.
So the first one is 820 to 830 nanometers, right? That's
for the wavelength.
And with a average 5.9 joules per point, which comes out to be 15 to 180 seconds per point. So let's say
15 seconds to 3 minutes.
I'm going to put my laser here and hold it there for 15 seconds to 3 minutes at that 820 to 830 range.
But they also were saying that the joules, because every device has a different intensity
Yes.
for the wattage. And so
That's a calculation you'll have to do.
you'd have to
use
do the
AI.
calculation.
That's what we do.
Yeah. For that, double check it if you use AI.
So the second therapeutic range was, they said 904 nanometers with a 2.2 joules per point, which is actually 100 to 600 seconds. So what is that? It's like a minute and a half to 10 minutes.
Mhm.
So,
Which is
and
interesting, because
it
lots
is
of masks and stuff you see are like, use it 10 minutes or twice a day or 10 to 20 minutes. Yeah, I think this was a cool study.
It is a cool
I'm
study.
really excited about light therapy. And if you know about light therapy, or have other thoughts, experiences, articles you want to share, we would love to hear them.
Yeah. Wait,
Or
did we decide?
questions that we can help you determine? But oh, right, proof or potion.
Is it proof or potion?
I knew we had some way we had to end the
Yeah.
video.
I mean, so I'm leaning proof, but I feel like I always lean proof. It's not fair.
I lean proof too.
Okay.
Although I do want to point out real quick, last final thought. The VAS scale, I get kind of bummed with a lot of these because
Yes.
out of 100, people were starting at a 57 in pain. So
like
we're saying
in the
like a
middle.
6 out of 10, let's say, if we're rounding up.
6 out of 10. Yep.
And then they come down 20 points with the intervention.
So they'd be at a 4 out of 10.
And 12 to 15 down is considered significant,
Right.
according to this study. I'm like, if I'm still at a 4 out of 10 and it was a 6 out of 10, I have a hard time even deciding, if I'm at a 5 out of 10 or a 6 out of 10. So if you're like, I'm too less, like, I do think it's significant. I do think there's some proof, but I always want to see it like, I went down to 2 or I went to 1. And I think part of that problem is that if they're looking at all of the studies and half of them weren't using the right wavelength, the right intensity, the right duration, the right number of treatments, and this was chronic neck pain of unknown origin, like we're dealing with a very heterogeneous group of studies.
Yeah.
And
it's also unclear how many treatments and for how long, right? They said treatments ranged between 1 treatment to 15 treatments.
yeah,
So I'm like, if you've had chronic neck pain for 8 years and you get 1 treatment,
do we
like,
think it's gonna make,
like,
so that was included in the study, and maybe you got like the lower range at like a 0.02 joules. Is that going to do anything? Probably not. So maybe that skewed the results where.
Right. But if you had a 2-point reduction after 1 treatment after 7 years of neck pain, hey, that's cool. And if you've gotten a second treatment or third or, like,
yeah,
we just don't know, right? Like that is the shortfall of a meta-analysis. It's like sometimes the finer details of trial and study results get kind of lost in the sauce in a meta-analysis. And maybe that's just, is that just research?
It's just research. And that's what leads us to the next study of like, maybe now we take that therapeutic window.
Yes. And really focus down. Yes.
Yeah. That's
how studies go. Broader, narrower.
And we figured out some things by looking at all of this data that these groups did. Now let's do the next thing.
Yeah.
So,
and now we know as clinicians, right? Like if we're ever treating with this therapy, like for this specific condition, we would be using those specific therapeutic window.
Do you think we'll ever be able to say proof or potion? We're going to leave you on that note.
Thanks for hanging with us. We'll see you next time.
Bye.